Welcome to ETMC TV and this informative presentation by Rachel Cox, licensed clinical social worker at ETMC Behavioral Health in Tyler. Ms. Cox will discuss outpatient day treatment programs for adults.
The purpose of the day treatment program at BHC, primarily it's designed to help adults cope with stressful life situations or emotional difficulties, things such as depression, anxiety, grief and loss, like complicated grief and loss issues, relationship problems. And the focus really with day treatment is allowing someone to get the treatment that they need during the day, doing daytime programming, while being able to go home in the evenings and still stay connected to family, friends, community, instead of being hospitalized as an inpatient. I think a strength of the day treatment program is getting confidential treatment with highly qualified staff. I do believe we have some excellent clinicians and therapists, so I believe people really will benefit from that experience. They'll be working with the therapist and the doctor to put together their treatment plan, like an individualized treatment plan. Individual therapy, group therapy, and family therapy, those are our three pieces that are offered as part of day treatment. Most of the time each day is going to spend in group therapy, or what we call group work, and that allows them to work and interact with other people who may be experiencing similar problems, and so they have a chance to bond and learn together. People come in a lot of the time with strained relationships or a lot of relationship problems, and so trying to teach them those communication skills and working with couples and families can be beneficial. Other things that they learn in the group work are just self-care and wellness, because a lot of the time with depression and anxiety, it's real easy to slip into patterns of not taking good care of yourself. So trying to help them that way. And then we also work a lot on people's thinking patterns, being able to help them kind of move from that negative or hopeless or pessimistic type outlook to a more hopeful or realistic outlook and approach. There are actually quite a few symptoms to look for if someone is concerned that they might have depression. I mean, for some people, it can look like prolonged sadness, not just kind of normal feelings of sadness, but prolonged sadness, unexplained crying spells. For some people, it'll show up as increased irritability, anger, worry. Sometimes people will also describe not really feeling anything. They'll say they feel indifferent or they feel numb. One of the other things you'll see also is sometimes people will talk about feeling like excessive guilt or worthlessness. There are also like physical and behavioral changes, and a lot of the time it'll show up for people in like major shifts in their eating patterns or appetite and sleep patterns, and also energy level, because generally you'll hear people report like loss of energy or really low energy, lethargy almost. A behavioral change that's really common is when people start socially isolating. They withdraw and don't interact as much. And I think another thing I also hear that's sort of a behavioral change is just an inability to function, just a hard time kind of completing their daily tasks, like trouble concentrating, trouble with focus and memory, sometimes just inability to make even simple decisions. And then I think one area that we get most concerned about that goes kind of with the mood and the thinking patterns is when someone develops hopelessness, and then they end up having recurring thoughts of death or suicide. And obviously, from a clinical standpoint, that's when we're most concerned, where we feel it's most dangerous if a person gets into that type of thinking pattern. A couple of things I think are really important. If a person is seeing these symptoms, or maybe a family member is recognizing them in a loved one, then two things. One is to have a medical evaluation, and then a mental health evaluation, because it is important. There are some of the symptoms of depression that can also, show up in other medical problems. If they rule out medical issues or medical causes, a mental health evaluation. And I think that's where Behavioral Health Center comes in, because we can set up that confidential assessment or interview so someone can come in and get an evaluation. If the person is actually at the point where they think, okay, I'd like to set up an appointment, then they can call our phone number, the 903-266-2200, call and actually set up a time for an evaluation. If they like accessing information on the computer, then they can go to our website, etmc.org, and go into the Behavioral Health Center section and just read more information if they would like to get information that way. But if the physician, the psychiatrist, believes day treatment is a good option for the person, then that person would be admitted to the day treatment program, and it's flexible and again based on the individual needs and what the treatment team recommends for the person. One of the things that is really important before you leave is that you and the treatment team develop a plan for that person. So generally it would be setting up counseling or therapy appointments, maybe on an individual basis. Someone may still want to do marriage counseling or family counseling. And then if the psychiatrist has been working with them with any type of medication management, setting the person up for follow-up that way. And then sometimes just hooking the person up to resources in the community, local support groups, or things of that nature that could be a resource to them.
For general information about ETMC Behavioral Health or to make an appointment, please call 903-266-2200 or visit etmc.org and click on Behavioral Health. To speak to a mental health professional any time of day or night, call the 24-hour crisis line at 566-0088 in Tyler and 1-800-566-0088 outside of Tyler. ETMC Behavioral Health is an in-network provider for Medicaid, Medicare, and most insurance plans.